I'm Lisa Tarr, CEO and founder of First Steps Pediatric Therapy and First Steps Clinic, and we provide occupational and physical therapy in our clinic, virtually, as well as home-based services. And today I'm here to talk to you a little bit about how pediatric therapy can help you with your children with learning struggles. As a parent, you know your child's smart, but then they struggle with focus or they get frustrated when they're learning something new. And I'm here to tell you that pediatric therapy actually can help your kids who actually struggle with the learning. And it's not by doing more schoolwork, it's like by helping them support on how they learn best. So a lot of times our learning struggles are linked to other developmental delays. So you're gonna notice kids who can't sit still, they avoid tasks, they struggle to follow multiple step directions, they melt down when you give them demands, and they really just, I want to tell you is they're not acting out. They're actually, you're seeing these behaviors because there's a sign of either a sensory processing difficulty, auditory processing, or a language processing delay, or underdeveloped cognitive or motor skills. So statistically, 1 in 5 children in the US have a learning or attention issue cited by the National Center for Learning Disabilities. And really, it's not bad behavior. It's really just the brain's way that is wired that is learning a little bit differently. So traditionally, parents really think about, is my child falling behind academically? Let's try tutoring. Or tutoring isn't always the answer. So I'm here to tell you that more practice won't really fix those underlying problems. Like, hey, you have a kid that's have difficulty sitting in a chair, or they have difficulty processing verbal directions or instructions from the teacher, or they are having difficulty with their emotional regulation and they're shutting down during school or homework or any type of time you're giving them some feedback or support, or you're asking them, trying to parent them basically, and they're having emotional shutdowns. So that's usually a good sign that your child might have a sensory processing challenge. And so tutoring, tutoring's great, and tutoring does help what they actually learn, but therapy is going to help how the child learns. So for example, if your child can hold a pencil right, there's no amount of tracing is going to help you with your child to learn how to do tracing, but occupational therapy can work with you to work on grip strength, adapting pencil grip, and developing strength within their hands. So pediatric occupational therapy helps kids with their focus and attention, as well as they help with sensory regulation and emotional functioning. So if your child melts down from like a noise, or they can't organize their own tasks, or they avoid, lots of writing or reading, occupational therapy can help with those kids. Pediatric physical therapists help kids build the strength, endurance, posture control, and support sensory motor skills with regulation. And then they also can develop skills to help them focus on learning. And we treat kids who are often, slumping down, they fatigue easily, they struggle with motor coordination and learning any new skills. Starting pediatric and occupational therapy early actually can help build confidence and support your child proactively before they hit school age. And it's really something doesn't have to be wrong to help your children. They don't have to be recovering from an injury. So that's more of a common myth. You can really look at physical therapy and occupational therapy with children is more of like a personal training versus actually having an accident and needing rehabilitation. So we're not going to wait till our kids actually fail to provide services. So we actually want to hit those kids earlier on to help so they don't have emotional dysregulation and difficulty within school. And supporting our kids early for therapy is going to really build that foundation of success. And then it's going to help them with their increased ability to participate in tasks. They're going to be able to focus better. They're going to have better emotional control. They're going to have increased coordination and better communication skills with their peers. And statistically, kids who actually get early intervention services and or earlier services are 4 times more likely to make significant gains before school starts. And this is part of that whole reason why that Individual Disability Education Act is a federally mandated program. So if you feel like you've learned something new and or you're constantly battling with your kid for any of the things that I've mentioned earlier, contact us for an evaluation. We are here to help. Pediatric therapy isn't about fixing kids. We're about actually supporting kids and helping them with the tools that they need to help them excel in their own way. So please contact us to schedule an evaluation at 720-989-0179 or check us out on our website at firststepspediatrictherapy.com. Please remember that we provide a free 15-minute consult if you're unsure prior to scheduling.